Hey guys, so today we are going to discuss about certain important VIVA question from the palmar regions, which are frequently asked, but students are unable to properly answer them. So here we go. What are the deep fascia of the palmar region? So whenever this question is asked to you in VIVA, then you should define about three deep fascia. First of all, obviously the main fascia, that is the palmar aponeurosis, and then you have to tell about the deep fascia of the wrist, that is this one, the violet color structure, that is the flexure retiniculum, and then you have to tell about the deep fascia of the fingers. In fingers, you can see there are certain fibrous flexure sheath which is called as the deep fascia of the fingers, right? Then this question is very important. It is important from VIVA point of view. It is also important from theory point of view. So what are the structures passing deep and superficial to the flexure retiniculum? Just now I have shown you the flexure retiniculum. So you have to know about the structures that are going over the flexure retiniculum and about the structures that are going underneath the flexure retiniculum. So I'm also going to prepare a separate video on this topic, and you should certainly watch that video. That will be helpful, I believe. Then we have the Dupuytren's contracture. This is a part of the clinical part of the palmar region, right? It's basically a kind of disease where the fingers are going to get flexed. Actually, what happens in this disease is that the muscles of the palm get contracted, so the fingers get flexed, and the patient is unable to again straighten his fingers. This disease mainly occurs in male, that is also in older males, let's say above 40 years of age. And this Dupuytren's contracture basically occurs in the ulnar side. So the ring finger and the little finger are more affected by this disease, and to be more specific, the ring finger is mostly affected by this disease. Then we have the anatomical snuff box. Here you have to learn about the boundaries of anatomical snuff box and also its contents. I'm going to make a separate video on it. See, this is the anatomical snuff box, this depression, which is medially bounded by the extensor pollicis longus and laterally bounded by the extensor pollicis brevis. So you should and must go through these questions before attending your VIVA. Thank you very much. Have a nice day.